Good day, everyone. Today, we are going to talk about COVID 19. A new virus attacks the world, and a necessary situation was produced, resulting to a change in the living of the society. Based from the data and information presented by the World Health Organization, last January 4, 2020, a new virus was born in Wuhan, Hubei province in China. At first, doctors and scientists thought that it is just a cluster of simple pneumonia cases until it reaches its severe state. And the experts saw that the new unidentified virus inhabits the body of the patients. A week after the identification of the virus, several characteristics of the virus disease had been shown, such as its symptoms on how it can be detected and how to test if the person had the virus. They found out that the new virus, which is the nCoV-19, is same as how the SARS and MERS affects our respiratory system, and it is the main target of the virus. Since it is like the past virus, it is expected that the transmission happening on the respiratory system of the body until it affects the whole system. In just a small span of time, the virus was detected outside the country, and the pandemic started affecting all of the people across the globe. Being in this situation where the new virus attacks a person's respiratory system will make a great impact on how this new virus or the COVID 19 can affect a person's respiratory system. We must always put on our minds that respiratory system is responsible for breathing, which are simply classified as our inhale and exhale cycle. Since COVID 19 is now considered as a respiratory disease, it is obviously attack our respiratory system, especially our lungs. Sadly, COVID 19 has already spread all over our country, which gave us a different hindrance in life. This type of new virus that resulted into a new disease gave us the difficulty to treat it right away. And up until now that a year had passed by, vaccine was produced just for herd immunity. Today, we are going to have a conversation with some citizens of the Philippines who got the new virus and experienced the disease itself. Presenting Cedrick Bautista, Jean Malagad, and Kurt Pascual of Cabanatuan City. Good day, everyone.
Good day, Doc.
Good day, Doc.
Today, we are going to have an online interview on these three on what they have experienced when they got the virus. Do they suffer, or do they experience near death experiences? Or do they find themselves more productive? Coronavirus disease is an infection disease caused by a newly discovered coronavirus. COVID 19 is a disease caused by a new strain of coronavirus. CO stands for corona and VI stands for virus, and the D stands for disease. Formerly, this disease was referred to as 2019 novel coronavirus or 2019 nCoV. It mostly affects the respiratory of a person due to its symptoms and sometimes when a person with an old disease got infected by the said virus. Different complications were happening until the respiratory system stops to work. Hi Cedric, good day. He is the first one to experience this disease before the other two. Cedric, kindly tell us when did you got the disease? What did you experience and what is the possible causes and symptoms did you experience when you got the disease?
Hi, Doc. Good day. I got the said virus last month because I am always going outside of our home due to the work that I have without doing such health protocols such as wearing masks and face shields in a matter of I don't believe on this disease first due to some fake news until I got it. After several days, I am feeling unwell to the point that I don't have the appetite to eat until I experience fever and tiredness. At first, I thought that it is due to the work that I am doing, and I thought that I am just exhausted from the work until I had diarrhea, dry cough, and also dry cough that makes me breathe not normally, and I lost my ability to taste flavors after 3 days of experiencing some symptoms. And eventually, I went to the hospital just for checkup because I think that this is just a simple fever with diarrhea. But after telling the symptoms on what I am experiencing, they eventually test me for COVID-19, and they suggest a home quarantine on me until the test result was given. And after 3 days, I got my result and it tested positive. An emergency vehicle went on my house and they suddenly rushed me on a quarantine facility with hospital that I am sure that that hospital will help me to treat my disease. And after such weeks, now I am COVID free.
Oh, thank you, Cedric. It is too hard to have the disease, especially when different symptoms came out of your body. And it's not that easy to handle by yourself. Sometimes a person is asymptomatic, where even though they had the virus, such symptoms were not in. Our next COVID free patient is Kurt Pascual. Hi, Kurt. Kindly tell us some diagnostics procedures that they do to you. Kurt?
Good day. After hearing the disease on the television, I eventually went to the hospital because my breathing was not that normal than before due to the cough I'm experiencing. They suddenly do diagnostic procedure on me to check if I had the virus. And the first thing is the swab test. A long hole swab using the inserted in my nose to a quick throat swab is the example. A health professional inserts a thin disposable liquid cotton at the tip or brushes that swab along the back of my throat to collect a sample of the mucus that they were saying to me. It is too uncomfortable. The swab remains in place briefly before being gently rotated as it is pulled. The sample gets sealed in a tube and sent to a lab for analysis. And after such few days, the test result was given to me via text. I heard that they are also doing such saliva tests now as their new diagnostic test.
Thank you, Kurt. It is true that the swab test is too uncomfortable, and sometimes they feel it painful since it is just their first time to experience. Our next is Jean. Hi, Jean. Kindly tell us the treatment that they do to you when you are admitted on the hospital.
Hi, Doc. When I tested positive on the respiratory disease, my parents suddenly admitted me on the hospital to treat me even though it is just new. They say that the cornerstone of the management of COVID-19 is supportive care, which includes treatment to relieve symptoms, fluid therapy, oxygen support, and prone positioning as needed, and medications or devices to support other affected vital organs. They do monoclonal antibody medication on me. Monoclonal antibodies are human-made proteins that help the body develop an immune response against foreign-made substances such as viruses. Some medications that they given to me are bamlanivimab from Eli Lilly and casirivimab and imdevimab, which must be administered together from Regeneron Pharmaceuticals. Like that, like the remdesivir that they are saying, they also administered by 4 infusion and intend to treat COVID-19 in people ages 12 years and older. These medications are used for outpatient therapy, and after a month, I am a COVID-free person now.
Thank you, Jean. Oh, it's wonderful to hear that even though it is new, there is a way to treat in order to save lives. Thank you for the three of you, and I hope that your lives will shine on the darkness. Thank you. We must always remember that the best way to prevent and slow down transmission is to be well informed about COVID-19 virus, the disease it causes and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose. When an infected person coughs or sneezes, so it's important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow. Thank you for watching this documentary, and I hope that learnings were nourished by everyone. Always wear your mask and don't forget to protect yourself and love yourself. Goodbye, adios.